Can you explain the clinical significance of a low alkaline phosphatase value and why we should be paying attention to it?
Sure. So alkaline phosphatase is an enzyme that's found in the liver and the bone, and it plays a crucial role in bone mineralization. I think that's something that we as rheumatology clinicians really need to pay close attention to and learn how to investigate it, because these patients will show up in your clinic.
So from your experience, what are the clinical clues that would prompt us to pursue this further evaluation when we see a low ALK phos level?
Okay, so the clinical clues can be sort of vague and nonspecific at times. Anyone who has chronic musculoskeletal pain, lots of fatigue, but the specific things that ought to clue us in and turn on a little light bulb for us would be any history of a non-healing fracture or potentially losing teeth, like dental disease where they are losing teeth for no reason, potentially a history of nephrolithiasis because of an increase in calcium levels, or patients who have a history of CPPD type of flaring where you might be concerned about chondrocalcinosis in those patients. This is not going to be a one-off reading where everything else has normalized. These patients will have chronically low ALP, and you can usually do some sort of trend feature in the lab in the EMR, and you can look at over time, multiple levels of low ALP, and that's your patient where you want to really hone in on that diagnostic workup.
Okay. So we see a patient that has a persistently low ALP. We obviously are thinking about some of the other causes, which you mentioned, but really we should be kind of thinking about, this genetic disorder and potentially adding that to our workup for the patient, particularly if they've had a history of non-healing fractures, if there's a family history of genetic issues,